Every second patient in my OP comes with a complaint of, Ma'am, I have irregular cycles. Ma'am, I don't remember the last time I had a period. Ma'am, I'm gaining a lot of weight. Is there anything that I can do about it? Let's talk about the elephant in the room, PCOS. That is Polycystic Ovarian Syndrome. I'd like to call it a hormonal circus. It keeps on giving to the women. Let's just dive into the wacky world of polycystic ovarian syndromes. Our ovaries, a woman is born with two ovaries, like you know, and the total number of eggs that she's ever going to have in her life at birth. So, unlike men who can produce sperms as and when required, almost till 75 years of age, women cannot produce new eggs. That is, we have limited edition ovaries. Now, what is happening with the limited edition ovaries? Our ovaries remain dormant till a girl attains menarche. That is, till the girl starts to have periods in her life. So, periods or the menarche is like a wake up bell for the ovaries to function. And after menarche, a girl has regular menstrual cycles because of so many hormones which play in sync to give the periods. So, what exactly is happening in a menstrual cycle? So, the menstrual cycle has two different phases. The first is the follicular phase and the second is the secretory phase. So, in follicular phase, there are multiple eggs which are trying to grow and one of them becomes a dominant follicle. So, this dominant follicle comes out of the ovary through a process called as ovulation, reaches the fallopian tube and waits for the sperm to come and fertilize it. That is pregnant. If the fertilization does not happen, what happens is the egg degenerates and comes out in the secretory phase, after the secretory phase, as period. I mean, your uterus is very disappointed that the pregnancy did not happen, the fertilization did not happen, and kind of cries out the inner lining out, is your period. So after period, the cycle restarts. Follicular phase, ovulation, and secretory phase. Now, for this whole thing to happen, your hormones have to be in perfect sync. Your female hormones, that is the FSH, the LH, estrogen, progesterone, all of them have to work in sync. Now, imagine ovaries to be partying and they inviting more number of guests than they actually should. So these extra guests are nothing but the polycysts or the multiple cysts which we identify in the ovaries, right? So these extra cysts, they kind of, change the balance of the hormones. They are making your ovaries overwhelmed with too much noise. And that's exactly when your hormones go haywire or imbalanced. So this hormonal imbalance what that leads to PCOS shenanigans. That is the whole problems associated with PCOS. Now remember I said only one egg is required to get you pregnant. I mean, one egg, meaning one sperm is all that's required to get you pregnant. Now in polycystic ovarian syndrome, you have multiple eggs, yet none of them are actually getting you pregnant. So there are so many other associated symptoms or signs or problems associated with polycystic ovarian syndrome, and I'm going to drop all the videos in detail about PCOS in this PCOS series. I'm Dr. Santoshi Nandigam, consultant obstetrician and gynecologist. I'm going to talk about women's health in detail, pregnancy, childbirth, cancers, PCOS, everything that you need to know to keep yourself happy and healthy. Please subscribe to my YouTube channel and let me know more. Thank you very much.